Hello, and it's great to see you online. Today, we're going to talk about the scope of practice of medical assistants in the state of California. California is the state that I have spent my career as a medical assistant, and so we're going to start with the state of California. And the way I wanted to do that was show you around the Medical Board of California, because that is who oversees medical assistants and their scope of practice. And so I have typed in here, you'll see under Google search, Scope of Practice Medical Assistant State Medical Board of California. So we're going to go to that site today and we're going to check it out, and I'm going to show you where to get lots of important information, not only about scope of practice, but also about what certifying boards are recognized in California, answering other questions that you might have. They have a frequently asked question area as well. So let's go ahead and start by going to the Medical Assistant Medical Board of California website. Clicking into here, you'll see that it's under physicians and surgeons, and as you scroll down, you'll see medical assistants. And first, I wanted to touch upon this point. Medical assistants are unlicensed individuals who perform non-invasive routine technical support services under the supervision of a licensed physician or surgeon, podiatrist, physician assistant, nurse practitioner, or nurse midwife in a medical office, so an ambulatory care setting or clinic setting, without the need of receiving certification. The supervisors must be on the premises in order for the medical assistant to perform non-invasive technical support. So in California, there are two ways that it can be gone about. One is to be registered or certified with one of the recognizing certification boards, or you can work with a physician and under a physician for a certain amount of years, and then through that process, you can then get your registration or certification. So the first question you might wonder is, well, where do you go to get this certification or registration? So as you go down here, you'll see what they list as qualified medical assistants. And so you can read over that and get more information. And I wanted to show you here the board approved medical assistant certifying organizations. So most of these are national organizations, and these are the only ones that the state of California recognizes in order for you to have your registration or certification. So it's really important that you do some research here and that you understand where you can go to do that after you've completed your schooling or your years of service under the physician. So American Associates Medical Assistants is one of them. And again, handy, they have the sites here, so you can just click right into those. The American Medical Certification Association, the American Medical Technologists, and that's what I am. I am a registered medical assistant, and that is through American Medical Technologists, as well as I am an allied health instructor certified, also through American Medical Technologists. And then those that I just read are nationally recognized boards. There's also the California Certifying Board of Medical Assistants, and that sits specifically for the state of California. And then the last one they have listed here that they currently recognize is Multi-Skills Medical Certification Institute Incorporated. And so when you go to do your certification or registration, you want to make sure that you visit this website and you know which board you're going to certify it under, and you can click right into the links there and get the information on what it takes in order to sit for those tests and get that certification. So make sure that you go back and visit this prior to, because they do change every now and then as far as who California will recognize. Now, the interesting thing that I really wanted to touch upon today is where you can find information about your scope of practice in the state of California. Right underneath the certifying boards, you'll see that they have the question, is your medical assistant practicing beyond their scope of training. And here you can visit and see what constitutes within your scope of practice for the state of California. So I'm going to focus on this down here because these are things that are not allowed by the state of California for a medical assistant to perform. And then I'm also going to show you where the frequently asked questions are, so that you can review those questions, and a lot of times it will answer questions that you had just by visiting that part of this site. So medical assistants are not allowed to perform such invasive procedures, right? Because medical assistants work in the non-invasive. They're not allowed to be placing the needle or starting or disconnecting an infusion in IV procedures. So you are not allowed to place IVs. You are not allowed to administer medications or injections straight into an IV line. However, you are allowed to administer medications and injections. There are some restrictions as far as what type of medications that you can inject. You are not able to chart pupillary responses. You're not allowed to insert a urinary catheter. You cannot on your own perform telephone triage. This means if you have protocol that's coming from the physician as far as if this occurs, then do this. If this occurs, then do this. You are allowed to work within your physician and with your physician to perform the triaging, but nurses are the ones who are able to do phone triage without having those set protocols in place. You are not allowed to inject collagen. Also, not able to use lasers to remove hair or wrinkles or scars, moles or blemishes. And medical assistants cannot administer chemotherapy. So these are some main areas to know, do, understand, and apply within your scope of practice. So make sure that you come and visit this site, as well as you can go to, let me see if I can slide up here. There's also frequently asked questions, and I can't remember, I think it's right here. So right under the certifying boards, you can click on frequently asked questions for medical assistants. And I find this to be the most helpful. And this is what I use with my courses to go over and actually check for knowledge after, as far as the information in here. First of all, interesting to come and visit and see what your training should include. So if you're just now starting out and you're looking for a good solid program, make sure you read over this part, because you're going to want to make sure that that program has the 10 clock hours of training in the administering injections and the skin tests, also 10 hours of training in the venipuncture and skin puncture for withdrawing blood. You need to have at least 10 each. You have to have 10 intramuscular, 10 subcutaneous, and 10 endodermal injections, and 10 skin tests. And also, if you're doing the phlebotomy part of it, you do not have to, not all programs do the phlebotomy certification, but if you're doing the phlebotomy certification part of it, you also need to have that at least 10 venipunctures and 10 skin punctures successful and signed off within the program. You also need 10 hours of training in administering medications via nebulizer, and this is really important for inhalation medications. Training above shall include instruction and demonstration. And then it also lists that you must know for those things pertinent anatomy and physiology that are appropriate to those procedures, choice of equipment, proper technique, hazards and complications that might happen, patient care, how to follow up treatment and follow up tests, emergency procedures, and California law and regulations for medical assistants, which is exactly why we're visiting this site today, so that you can get familiar with that. So once you go down there, this is the part that I love. In the green here, you can see the green highlighted. It has a question and answer. So this is just one example. Are medical assistants required to be licensed or certified by the state of California to perform procedures within their scope of practice. Medical assistants are not required to be licensed or certified by the state of California. However, the medical assistants, employers, and supervising physicians or podiatrists, malpractice insurance carrier may require that the medical assistant to be certified. So you'll see when you're going to apply for jobs in the area of medical assistant in the state of California, the clinical medical assistant particularly, you will see some will require that you are certified or registered. And for those jobs, many times it's because their malpractice insurance requires that they hire a medical assistant that is certified or registered. And then down here, you can get your questions answers, such as, are medical assistants allowed to administer injections of scheduled drugs? So it says if the medical assistant has undergone the appropriate training, he or she is allowed to do these injections once the licensed person has verified the correct medication and dosage. So when we do dosage calculations, they're very, very important that we understand, because that is something that can truly be a life or death or injury situation. So when we are allowed to administer certain medications and dosage calculation is part of that, you typically are going to the physician, or if you have a licensed nurse. For our pediatric department, we had a registered nurse with us in our department. So we would do the dosage calculations, we would draw the medications, we would then take it to the registered nurse for approval and to check to make sure that the nurse had verified. So again, I just wanted to help you be familiar with the site. Nasal smears is another question that we get a lot in the classroom, and it says medical assistants may perform nasal smears if the procedure is limiting to the nasal cavity. So this was very interesting during COVID, because a lot of times those were nasal pharyngeal tests. And so in order to perform a nasal pharyngeal, you're going beyond that nasal cavity back up, right? So medical assistants are not allowed to perform that type of nasal smear. But there are also other tests that are similar that you just have to smear inside that nasal cavity. So if you're doing that type of test, you are within your scope of practice. So can you see why this is very important to review and understand? And you'll go over this, I'm sure, within your program, but I just thought that this was such a useful site for you to have, and that throughout your career, you can come back and visit and have questions answered, and just make sure that you are operating within your scope of practice. So hopefully this was helpful for you, and that it answered some of your questions, and I look forward to seeing you online again. Have a beautiful day, and I'm excited that you are choosing an allied health career. Thank you. Bye-bye.